Okay, for this movement, we're working on isolating the hip flexor. We're getting some length through the muscles here on the front side of the hip while strengthening through hip and quads on the other side. So the key with this position is we're going to kind of be in a split squat position. Our rear foot's going to be elevated. Nothing too high, though we can go a little bit higher than this. That's fine. We can kind of play around with that position. We're also going to play around with how far back we want this foot, depending on, again, how that feels in the front side of this hip and how much kind of stretch or elongation we're looking for. Here's the position. It's just rear foot slightly elevated. We got some length through the front of the hip here. We're going to do a normal kind of split squat straight down from here. The knee drops straight down, and then we go right back up from there. Playing around with distance, we can get some true length through that hip flexor in this position here. Knees dropping straight down. And then again, same thing on that way back up, straight up and down like an elevator. And the knee position here, or length through this backside, is I want you to kind of work into that. So let this open up, let this hip go into extension, hang out here for a little bit, and then slowly come right back up. Something that we can play around with is when we're in that deep position there, is we can get you to think about trying to drive this hip forward out of that hip extended position, but the foot never moves, right? So the quad, the leg should never move. All I want you to do is think about from right here, think about pulling that knee forward, 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 but keep it there and you'll get this good isometric contraction through the muscles here in the front of the hip. So think when we go down, we're searching for some stretch in the front side as that hip goes into hip extension. Now I want you in that stretch position to contract that same muscle and kind of just live there for a little bit before you slowly come right back up. Okay? So this is how we can drive a lot of motion through the hip, teach it to get into hip extension again, and then teach these hip flexors here. We can put load through the hip flexors if there's some tissue damage there and we're trying to lengthen and load through it. And then again, we just get length through these muscles, which can be chronically pretty tight. Go ahead, give that a shot.